Ryan here with another taping video. This one's going to be of the thumb. We're going to secure the thumb in an athletic position so that they can get back out on the field. So let's get started. The first things first, we're going to use some pre-wrap. And before we get the pre-wrap on, we want to make sure that the wrist is in line with the forearm. So if we're looking here, everything's in line. Good. We don't want it bent or up into a position. So nice and straight. Okay. And then we also want to make sure, what I like to tell the athlete is to make a hand like they're gripping a cup, okay, or a can or a soda, what have you. Good. A little more grip for me. Perfect. Okay, because this is a natural athletic position. There's not going to be a lot of athletic sports where the hand isn't in this grip. So that's what we're trying to enforce. So back in, a little pre-wrap. We're going to go down the wrist a little bit, and we're going to come back up, and we're just going to bend it right here, just to protect the skin, nothing too fancy. And now here's the first strips, which we're going to do are the spica strips, and I already have some pre-ripped strips. This fits around the athlete's hand, pre-measured. So we're going to start on the distal ulna. Okay, we're going to come around. Make sure we're keeping that C grip. And we're coming down the hand. Same thing. Coming around. Locking in place. We'll do one more with the full strip just to lock everything down. Once again, at the base of the ulna. Coming around through the hand. Making sure we're not pulling on anything. Right now I'm just stretching the tape out. I'm not pulling on the hand. And then we'll finish once again back at the base of the ulna. Trying to avoid this soft spot of the hand. This responds really well to pressure or force, so we're trying not to put any pressure on this part. This will be really uncomfortable for the athlete. Okay, so now that we have these strips down, we're making sure that we're on these two bumps, that they cross on this bump, on this radial collateral, this RCL right here. So now what we need to do is we need to support the UCL. So what we're going to do for that is we're going to take a strip, we're going to move it around the thumb, then we're going to move it back around the hand, and then finish up the base. Once again, we're going to do that one more time. What we can even do on this strip is once we anchor it onto the thumb, as such, we can get a little pull into the hand to bring it down. And back around. Like so. That movement is a check rein, if you will. So we're going around the thumb, locking in the UCL into a good position. No pulling as such. And what we want to do is fix up these little windows, like we spoke about in the previous ankle taping. So just fix up the window a little bit with some C-strips. Go down the wrist, lock everything into place, seal everything up. And as such, she has mobility. And what we can do too, we can do like a little bro handshake, and that'll keep everything nice and tight. We can lock everything to its position. And there we go. We have the spica thumb tape strip, locking that thumb into place, giving some stability. Thanks for watching. Alright, so let's talk about some therapy methods that we can use in order to treat the sprained thumb. We have our thumb here. Now obviously we wrapped it, which is really good. That can add compression, and it can also add a lot of stability to the thumb. But what we really want to do is we want to start to create some therapy. So one of the things that we can do is using the Price method. So protection, rest, ice, compression, and elevation. So one of the things that we can do, obviously we have the compression with the wrap going around, our ULC and our RLC. But what we can also do is add some ice. So right here we have an ice pack. This is just a store-bought pack. You can use a Ziploc bag with some ice, crushed ice, and then use any type of like rag. Pre-wrap works really well. I'd probably use some pre-wrap with this, but there's like a plastic layer, so we should be fine. So what we can do is we can just put this around the hand, and what's convenient is this has some strap to it, and we can figure out how we can wrap that around. And then we have her hand on ice, and we'd want to do that for 10 minutes every hour. For the first 24 to 48 hours, reducing the frequency as the symptoms of the swelling die down. Once again, too, we'd also want to use a compression bandage if we can get one of those. Using the splint also works to compress the hand. Rest is very important. As soon as the hand starts to feel a little bit better, hopefully there's not a severe fracture or anything of that nature. We just have sprain. We'd want to start to use some mobility exercises. So we'd want to do some wrist exercises back and forth. We'd want to start to move the thumb to and fro towards the hand, away from the hand, towards the hand, away from the hand, strengthening the UCL. But yes, the most important thing that we want to do right now is that Price. So making sure that we have the protection, keeping it out of harm's way. We're resting it as much as possible, not putting it into use. And if we are going to be putting it into use, we want to make sure that we're locking it up with that taping method that we used earlier with the Spica strip, and then elevation when we're icing. So those are some therapeutic methods that we can use when we're working on a strained thumb or any strain in the hand or in a ligament. So thanks for watching.